Omega-3 fatty acids, found in Ovega-3, are believed to lower the risk of heart disease. They are used in conjunction with diet and exercise to decrease levels of triglycerides and increase levels of HDL cholesterol. Some supplement products may contain harmful impurities, so it's important to check with your pharmacist about the brand you use. The U.S. Food and Drug Administration has not reviewed Ovega-3 for safety or effectiveness. It's best to consult your doctor or pharmacist for more information. As for the daily dosage, it is generally recommended to take Ovega-3 once a day with food. Taking it at the same time each day may help you remember to take it. When taking Ovega-3, it's important to follow the directions on the package label. If you have any questions, you can always ask your doctor or pharmacist for guidance. If you're using the enteric-coated capsules, be sure to swallow them whole. For the chewable form, make sure to chew it thoroughly before swallowing. And if you're using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon, and shake the medication well before each use. And remember, if your condition persists or worsens, or if you think you may have a serious medical problem, it's important to seek medical help right away. As for the best time to take Ovega-3, it's typically recommended to take it with a meal to help with absorption. The daily dosage can vary depending on individual needs, so it's best to consult with your healthcare provider for personalized recommendations. Some common side effects of Ovega-3 may include fishy aftertaste, if your product is made from fish oil, nausea, bloating, or burping. If any of these effects persist or worsen, it's important to consult your doctor. However, many people using this medication do not experience serious side effects. In rare cases, a serious allergic reaction may occur. Seek immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, it's best to contact your doctor or pharmacist. As for the benefits of Ovega-3, it can help with easy bleeding/bruising. The daily dosage and optimal timing for taking this medication should be determined by your doctor, based on your individual health needs. Before taking Ovega-3, it's important to talk to your doctor or pharmacist if you have any allergies to fish or any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's essential to discuss this with your pharmacist. If you're pregnant, it's important to use this medication only when necessary, and to talk to your doctor about the potential risks and benefits. If you're breastfeeding, it's also important to consult your doctor before taking Ovega-3, as it's unclear whether this product passes into breast milk. As for the daily dosage, it's recommended to follow the instructions on the label or as directed by your doctor. And the best time to take Ovega-3 is usually with a meal to help with absorption. When taking Ovega-3, it is important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without consulting your doctor. It is best to follow your doctor's advice on the daily dosage and optimal timing for taking Ovega-3 to maximize its benefits. If you or someone else has overdosed on Ovega-3 and is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center as soon as possible. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada, residents can reach out to a provincial poison control center for assistance. Your doctor may perform lab and/or medical tests, such as cholesterol and liver function tests, while you are taking Ovega-3. It is important to attend all medical and lab appointments and consult your doctor for more details. If you forget to take Ovega-3 on your regular schedule, take it as soon as you remember. But if it's close to the time of your next dose, then just skip the missed dose and take your next one at the usual time. Don't take a double dose to make up for the missed one. It's best to take Ovega-3 at the same time every day to keep it consistent. When it comes to Ovega-3, it's important to follow the storage instructions on the package. Make sure to protect it from light and moisture, and avoid storing it in the bathroom or freezing it. Keep it out of reach of children and pets. And when you no longer need it or it's expired, be sure to properly discard it according to the instructions from your pharmacist or local waste disposal company. It's also important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.